Okay, welcome back from that small break. And during the break, Linda had called in and had spoke to the producer, and she had mentioned that she had lost all the cartilage in her shoulder and was anticipating having surgery shortly, and didn't know what to do about additional medications. One of the things, Linda, that you might need to do is think about going to Las Vegas to get in your prescription field. You know, I don't know if it means anything to people, but I've always said that you vote with your pocketbook. So if your pharmacy is going to play games with your prescriptions, you might want to decide to take your business elsewhere on a more permanent basis and going to different, shop in different places. Remember, most of the retail grocery stores like Walmart and maybe not so much CVS or Walgreens, but Walgreens made their money basically as a neighborhood pharmacy where you would go in and get a decent deal on your prescriptions, but they would sell you things that they made a fortune on, which is in their small little shop. So Walgreens was featured in a book called Good to Great, talking about corporate structure and how they were able to do the same thing over and over and over again and not reinvent the wheel. And I think that's basically the way I perceive it. It's a big corporate entity, and if people were to realize that this is how they're playing games with people's health, would you really want to support that entity in business? Would you really want to continue shopping at Smith's if they're not going to take on your prescription, or they're not going to fill your prescription or order what you want to do? Do you really want to go to Walmart and shop there if they're not going to order the medications? And trust me, they know what you need, because most physicians write not only 1 month, but we write another prescription that's in the second month that doesn't get filled before X date, meaning when the DEA came in and changed hydrocodone products to Schedule II, they allowed an interpretation of the law, which means you could write additional prescriptions as long as they weren't 90 days from the date at which you saw the patient. So a lot of times we'll write 30 days and then give patients another 30 days depending on the situation, so that we can alleviate the burden on us, so that we don't have to see people for just refills. And so they know what they're going to need, meaning these people are regular customers coming in all the time doing that. And the fact that they run out of prescriptions is an absolute crime as far as I'm concerned. Louis.
Yeah.
Hey, Louis, how's that going?
I'm doing fine, Doctor. It's Louis DeCanio.
Yep.
Listen, I got a question now. A lot of people, as we get older, we take a lot of vitamins and stuff. Now, I take a bunch of different vitamins that I'm told are good for me. Are any of these vitamins like dangerous to us or anything like that?
Yeah.
Or if we take too much of a certain vitamin, can it hurt us?
Yep.
That's basically my question.
Okay.
All right, thank you.
Yeah, Louis, that's a really good question, and the answer is yes. You can take too much of vitamins. There are two groups of vitamins. There's the fat-soluble vitamins, and then there's the water-soluble vitamins. Basically, let's talk about the fat-soluble vitamins. The A, D, and E make up the majority of the fat-soluble vitamins. B and vitamin K and other ones are water-soluble, and they just pass through your system. And if you take a vitamin and you go to the bathroom and urinate, you'll see the color change in your urine. All the vitamins have been excreted. They also are digested by the liver. But the fat-soluble vitamins, they actually can build up toxic levels in your body. So it's very important to keep in mind that on every vitamin chart, they have the RDA recommended daily allowance, which is in percentages. So if you see that one basically has a 300% recommended daily allowance of the fat-soluble vitamins, and the dosing schedule should be 1 every 3 days so that you don't exceed that. Now, most people that are eating 3 meals a day or 2 meals a day really don't need excess vitamins, because their food is basically enriched with a lot of those vitamins. And like I said, Vitamin C being water soluble, you could take that all you want. You can't get toxic from it. Vitamin B. In fact, I've done this in my office. I've had people that used to come in to get vitamin B injections thinking it would give them energy. I just tell them, listen, get the sublingual version. You put it underneath your tongue, and lo and behold, it's absorbed through your mucous membranes, bypasses the liver. If you take vitamin B by mouth, it's basically sucked up by the liver and degraded, so you really never get it in your system. So the answer was shots, which obviously can cause pseudo abscesses, which are a collection of fluid under your skin that aren't infected. They can also lead to infection. They can lead to muscle destruction and a lot of other things when you get in an intramuscular injection. And you can get the same effect underneath your tongue, and we've done blood levels on patients to substantiate this fact. So if you're taking vitamin B12, I will not give another vitamin B12 injection. There's absolutely no need to do that because the sublingual drops are just as effective. So if you do get toxic on vitamin A, you can get pseudotumor cerebri, which is a condition where you actually swell the optic nerve and can have some other problems visually, and it's a very dangerous condition under vitamin A. Vitamin D, the normal level is about 100 in your blood. Vitamin E, the toxicity might be some liver issues and some other things. I'll have to research that, but suffice to say, vitamin D, you can get that all in the sun, but if you up here, in the winter when the days are shorter, 2,000 units a day will never usually put your vitamin D level over 100. And vitamin E is actually good for, some things. But like I said, 2 meals a day, you're getting most of the vitamins you need. And then my suggestion is that if you're going to take a vitamin, maybe take one a week, something along that has a multivitamin. Some of the heavier metals that you see in the Centrum silvers and some of the other things, selenium and all those other things, they pass through your system. The only one that doesn't is colloidal silver. It does stay in your system, and if you take enough of it, you will turn a nice color blue. But other than that, most of the things are usually taken in and taken out. Obviously, renal impairment can affect some elimination of some of these vitamins. So if you have renal failure or something else, you might want to really seriously consider limiting those. So very good question on that subject. Remember, moderation is the key, and if you overdo it, there are some consequences for that. And I guess gluttony is a sin, right? If you eat too much, you'll suffer the consequences of whatever that is. So hope that answered your question, but that was a very good sideline note. And on another note, one of the medications that I see a lot that's prescribed, and even I was under the occurrence, I've never really pushed this medication up to the limits that I've seen some patients come in, but Neurontin or gabapentin is a drug a lot of people take for neuropathic pain, and they take it for a lot of pain, and neuropathic pain meaning pain in your nervous system from either diabetes, nerve destruction of your nerves, or from something related to either headaches and things of that nature. So gabapentin was a drug that was developed as an anti-seizure medication, and it just so happened it had a little bit, it had more benefits with regards to chronic pain than it did with helping people with seizures. And that sometimes happens when you get medications prescribed. Look at Wellbutrin, which was an antidepressant, still on the market, but when they actually gave it to patients in the psych wards, they noticed within 6 weeks to maybe 2 months, most of those patients on that prescription were quitting smoking. So then it came out as a new drug called Zyban to help quit smoking. So Neurontin used for chronic pain, neuropathic pain. I've seen patients come in on 2,400 milligrams, a huge amount. But this is not a linear dose medication. What that means by the more I give of that medication, the more it does what it's supposed to do. But Neurontin does not do that. In fact, it can cause weight gain, it can cause fatigue, sleepiness, and some other problems. So If you're on Neurontin and you're on 2,000, 2,400 milligrams, I hate to say it, but you're probably taking more than you probably need, and you need to go talk to your provider about weaning that down to about 300 to 600, maybe at the most, milligrams a day to help reduce that. Now, since then another medication came out, which is second generation Neurontin, which is called Lyrica, and pregabalin. Lyrica does have a linear dose response. As you push a medication up, you get increasing results with that. So, of course, with any new prescription, the pharmacies aren't covering, the prescription plans aren't covering it, and it is a controlled class 4. I guess it must have had some small addictive potential, but for the most part, I would say if your Neurontin is not doing your job, then you might want to think about getting your doctor to switch your Lyrica and see if that doesn't help you with some of this pain. It's used in a lot of different avenues, not just neuropathic pain. It can be used to augment other pain medications too. And this might be a nice alternative to needing continued opioid prescriptions. Remember, pain is a multifaceted animal, and it exists on several different levels. So we're going to take a break before we start our last segment. It's been a pretty quick show tonight. So if you got a call, make sure you get it in right when we come back on. Thanks for tuning in.